Hello, everyone. We are live, hoping that you all can hear me much better this time. Please let me know. All right, you all. So today I'm coming to you all very, very, very special announcement. And for everyone out there, please let me know that you can hear me. Want to let you all know that Congress wants to take our health care away. That is what this government shutdown is all about. The bill is called H.R. 247. This bill would extend healthcare subsidies that make healthcare more affordable. These are the premium subsidies to help people on the Affordable Care Act that were given during COVID. They run out at the end of this year. And that is what the stalemate is about with this government shutdown. 24 million people get coverage off the Affordable Care Act, off the marketplace exchange. Now, they'll try to fool us and tell us it's all about the red state versus blue state. If you live in a red state, then you're not at risk. But I'm here to tell you that that's just simply not true. According to Kaiser Family Foundation, a bipartisan nonprofit group, they found that 78% of the American public across across party lines, would want these healthcare subsidies to be extended. We are talking Democrats, Republicans, independents, and MAGA supporters. They all agree that they want these healthcare subsidies extended. Tell me, why won't Congress do it? I want you all to know that they will try to tell us this is an illegal immigrant issue. This is not an illegal immigrant issue. Okay? It is not. To let you all know, hold on 1 second. Google stop. This is real life. This is not a legal immigrant issue, as much as they will try to tell you all that it is. Illegal immigrants cannot get health insurance, you all. They are not eligible. What I'm talking about here is not a DEI issue. This is an American issue. Geographically, 3 in 4 people on the marketplace who are benefiting from the Affordable Care Act, the subsidies that Congress is holding up, are in red states that Trump won in 2024 election. These are southern states. Again, according to the Kaiser Family Foundation, a bipartisan group, the top states affected in the South: Texas, Louisiana, Mississippi, Tennessee, Georgia, and West Virginia. Their enrollment in the healthcare exchange, you all, has tripled in the past 5 years. Do you understand? They are not even extending these credits for their own majority. Why would you not want to give your constituents health care? Listen, them taking our health care away for all of you all watching this, and I hope you all are sharing this because the public really needs to know, this battle did not just start with the government shutdown 13 days ago. This has been going on all year long. Okay, this has been going on all year long. It started with the one big beautiful bill that they started attacking our health care. In July 2025, when President Trump signed that legislation, cutting over $1 trillion from the healthcare system, it did several things. First of all, it made substantial cuts to Medicaid, total, and making it harder for people to be eligible for Medicaid. I can't tell you how many seniors I work with day to day who are now receiving bills and they're on a fixed income from their doctors that they cannot pay because they had no idea that their Medicaid was stopped. It is a fallacy that they're waiting until decades out, right? Because they estimate 10 to 17 million people over the next decade will lose their health insurance coverage. And when you hear that, you think, oh, well, the next administration will clean it up. This problem is not waiting until the next administration. This is happening now. In DC, Washington, D.C., our nation's capital, 25,000 people were cut from Medicaid. Their solutions? Minute clinics. Could you imagine getting your emphysema treated at a minute clinic? If not you, what about your parent? What about your child? It's happening. So before I came to speak to you all, I asked ChatGPT, I said, Chat, what are the effects if a large majority of society does not have health insurance? And these are a few things that it said. It said, number one, increased spread of disease. Increased spread. And I'm not talking about COVID here. I'm talking about what's happening now. Currently, the United States is in the middle of a measles outbreak. Measles was said to be eradicated in 2000. And you can fact check everything I'm saying right now. We are in the middle of a measles outbreak. Currently, according to the Associated Press, we have 1,543 cases of measles spread over 41 states. More than likely, somebody who's watching this now, it's somebody in your state that has measles, something we got rid of over 25 years ago. With less access to vaccines, right? With less access to healthcare, measles are just the beginning. And to put this more into perspective for you, over the past 30 years, we've only had 30 cases. Besides disease overwhelm, there will be an overwhelm of the healthcare system in rural communities, which part of that big, beautiful bill took funding from. The majority of Americans, a lot of them live in rural communities, and their hospitals will be overrun, if not closed. And lastly, preventable deaths. As common as things such as high blood pressure and diabetes are, left untreated, They can lead to death. If people cannot afford health insurance, they will die. I want to ask you watching this today, when does it stop? When does it stop? The best strategy America has come up with so far is to divide us by color. At first, it was white and black. Now, it's red and blue. Congress needs to pass H.R. 247 now. This is an urgent issue. Open enrollment for the Affordable Care Act starts November 1st. Insurance carriers have already submitted two different sets of premiums because they're aware that Congress might not extend these subsidies. Premiums are set to go up 114%. The Congressional Budget Office estimates that 4 million people will become uninsured in just the next few years if these subsidies are not passed. Many times, people who are on the Affordable Care Act, who are using these subsidies, are people like you and me, small business owners, employees for small businesses, where their employer coverage is too much, or where their employer um, doesn't have a big enough staff to offer them health insurance. Uber drivers, DoorDash, students, other gig workers, and the disabled. Republicans have made the argument that they want to open the government first and then they'll vote on it. But why should we trust them, you all? Why should we trust them? They are the same people who don't want to pay the military tomorrow. This deadline is nothing new for them. In February, me and my colleagues of the National Association for Brokers and Insurance Professionals swarmed Washington, D.C. and lobbied, went to their offices and talked to them about passing this bill. And I want to tell you this, every Congress person, every senator has someone in their office that specializes in healthcare. They are very aware of what's going on right now. So, what can you do about it? Because that's what this is all about. What can you do about it? Many times, it is by design that we feel helpless and powerless. But y'all are forgetting these people work for us. I want you to call your local representative first thing tomorrow morning. That's right, you can actually call them. You can call the U.S. Capitol Switchboard at 202 224 3121, and they will connect you. Again, that is 202 224 3121. You all, we can all agree that something is not right here. This country isn't right. Something's going on. A few weeks ago, we saw a young man get slaughtered in front of a college field full of college students. Lastly, I will say this. Them not passing this bill is the most devastating attack on the American middle class in the 21st century. Keep this in mind. It is easier to control people when they are sick, poor, and separated. Thank you for watching. My name is Melissa D. Hall, and please share this message.